For those with arthritis or weak grip, consider using a grip aid or an eye drop dispenser designed for easier squeezing. Here's a simple step-by-step guide you can follow. Step number 1, wash your hands thoroughly. Step 2, tilt your head back or lie down if you prefer. Step 3, gently pull down your lower eyelid to create a small pocket. Step 4, hold the bottle just above your eye without touching your lashes or skin. Step 5, squeeze exactly 1 drop into the pocket. Adding more won't make it more effective. For those with arthritis or weak grip, consider using a grip aid or an eye drop dispenser designed for easier squeezing. These tools can help ensure you only release the necessary drop without straining your hands. Step 6, close your eyes gently for 1 to 2 minutes. Don't blink or squeeze. Step 7, gently press on the inner corner of your eye near your nose. This stops the drop from draining away too quickly. Step 8, if you're using more than one type of drop, wait at least 5 minutes before applying the next one. This routine ensures the medicine stays in the eye where it can do its job.